Myself, Dr. Paresh Mehta, consulting physician and diabetologist, practicing last since 20 years. I had my personal hospital, Dev Care and Cure Multi-Speciality Hospital, which is a 30-bedded hospital. I had also partner and director of Surat Institute of Medical Science in form of SIMS Hospital near railway station Surat. That is also 150-bedded hospital with all the facilities under one roof. And one another clinic in Varacha that has been practicing last 17 to 18 years.
So how does Imeglimin fit into your regular practice with the current landscape of T2DM treatment options? Kindly share your experience.
Initially, they have come with the data with the placebo. So I would not like to use, but they came with some confirmative data with comparison with the metformin, and along with metformin, then I am start using with this medicine dose having a type 2 diabetes patient in early stage like pre-diabetic stage, or those patient having a not control sugar by adding 1 or 2 drugs. Then I have been start using Imeglimin as a part of add-on therapy. Now I get the result, so I am now regularly prescribing the medicine.
In what specific patient populations do you see the greatest benefits of using Imeglimin?
I have seen two kind of patient where we get the greatest benefit. One is the pre-diabetic stage, and second is those patient having a 2 or 3 oral hypoglycemic agent and not under control, and those are not tolerating oral medicine like metformin, where I can use add-on drug and reducing the another ongoing medicine, and I will see there are the good control of sugar after adding this medicine.
How does Imeglimin compare to other hypoglycemic agents in terms of safety and efficacy?
In any drug, we have to identify safety. What about the side effects? So here there are the almost negligible or less gastrointestinal side effect, or there are no chances of the hypoglycemia. And efficacy, it is as much effective as compared to other oral hypoglycemic agent. When we have added drug, we see there are more chances of to develop controlling of your sugar, more chances of develop to reduce medicine of other drug. So it is efficacy wise also equivalent to other OHA.
Would you like to share any real world case?
Real world, I would like to say those patients having a early stage with obesity within pre-diabetic, where patient HbA1c in between to 5.8 to 6.4, you can use as alone drug to make a target of 5.8 less than 5.8, because here chances of side effect are very less, and those patients are on 2 or more OHA where control is not there. We can use this drug as an add-on therapy, because this drug has a unique mechanism like this drug is affected mitochondrial level, which is the unique mechanism of action, because it is every cellular has a mitochondrial function. If this dysfunction has been happened, all your metabolism are paralyzed or disorganized. So this drug has a unique mechanism of action. By adding this drug, you become normalize your mitochondrial function, and by this way it will help to reduce your blood sugar level.
In recent time, Imeglimin sustained release formulation with Indian study has been launched in India. What is your opinion on that?
I think it is a far better, because there are almost negligible side effect with sustained release combination in comparison to plain.
How does the mitochondrial targeting mechanism of Imeglimin influence its clinical use?
Because after targeting, every drug has a unique mechanism of action, every OHA, but this is a targeting mitochondrial dysfunction. So if mitochondrial function is normalized, it is a cellular level energy production. So by this way, it will increase insulin secretion and insulin sensitivity. It also reduces the hepatic glucose production, and it also reducing in the weight reduction. So by this mechanism of action, it will help in many parameters of blood glucose lowering effect. So it comes in the unique treatment part of diabetic management.
What are the key safety and efficacy findings from clinical evidences on Imeglimin that clinicians should be aware of?
I think it is not indicated in pregnancy. Only pregnancy it is a contraindication. And from physician part of view, always watch for the two side effects: GI tolerability and hypoglycemia, which are the very negligible in this case. So it doesn't bother. And second and third most important is that when you added Imeglimin as a add-on therapy to any OHA, you have to reduce the dose of OHA because there are more chances to develop the hypoglycemia.
Do you believe that Imeglimin has the potential to change the future landscape of diabetes treatment?
Yeah, because has a unique mechanism of action. Other drugs available have a unique mechanism. This drug has a mitochondrial function, which is our energy or cellular level mechanism of action, which is make unique mechanism of action, unique formula, which will make a change in the treatment of diabetes in future.
Any other key points or take-home message you would like to give apart from this?
Now, I would like to say initially I am reluctant to use this medicine, but after getting trial with the result with the metformin, I am more enthusiastic and more frequently use this medicine as a add-on therapy in those patients are not controlled with the another OHA, or it may be used in the as a first line of drug in the pre-diabetic stage.